Today, I'm going to talk about abscess and how they occur from a Western medicine perspective and also from Chinese medicine perspective, and then also a herbal combination that we can use to treat abscess in the clinic. So, from a Western medicine perspective, abscess forms from bacterial overgrowth, and they can occur on the skin, they can occur inside the body, in the abdomen, inside solid organs. And what happens is the body kind of seals it off, it creates a wall around it, and it helps to protect the body from the bacteria spreading. But it can also limit the penetration that antibiotics and other treatments can have in reaching into the abscess and killing the bacteria there and helping to heal. And so, from a Western medicine perspective, usually when you have an abscess, the solution is that it needs to be drained. It needs to come out mechanically. And so, if it's superficially on the skin, that can be done by lancing it, opening it up with the scapula, draining it out. If it's inside the body, deeper in the abdomen or the areas, then you have to go in surgically or with a drain and drain it out that way. Now, from a Chinese medicine perspective, we don't have the terminology of bacteria. That wasn't something that was used in the classical Chinese medical literature. But abscess were recognized as heat pathogens, and they were considered toxic heat pathogens. So not just regular heat, but actual toxic heat, which is a different level of heat. And and to treat toxic heat pathogens, you would need to use a specific class of herbs that we call herbs that clear heat and resolve toxicity. And it can be used for different things, but one of them is abscess and to treat deep-seated toxic sores. So, for example, two of the herbs that do this is Gong Ying and Ziwa Ding. And both of these herbs are herbs that clear heat and they resolve toxicity, and you can use them together to especially treat abscess and deep-seated abscess. So from a Chinese medicine perspective, they both go deep into the body. Ziwa Ding is actually an herb that goes into the blood level, and it can go throughout numerous areas of the body to find and clear these pathogenic conglomerations of heat and toxicity causing abscess. And Gong Ying was initially uh, used to treat breast abscess. That was what it was initially thought to do, and then over time, its use was expanded to other cases. But as a combination, both of those herbs work together to treat abscess. So you can use it for intestinal abscess, for superficial abscess, for skin abscess. It's kind of a general herbal combination to treat abscesses. And so, from a Chinese medicine perspective, we view abscess as a form of heat toxicity. And the way to get the underlying problem resolved is to clear out the toxic heat. And so, from a Chinese medicine perspective, you need to use cold herbs that clear toxicity to do this. So, sometimes patients have recurrent abscess where maybe you have an abscess and then it clears out. You might take some antibiotics, it might go away, or you have to get it surgically drained, but then it comes back again in the future. And what that means from a Chinese medicine perspective is that the heat toxin was not totally cleared from your body, or you're somehow predisposed or have environmental factors that are causing it to return. And so, in that sort of a scenario, Chinese medicine can be helpful to try to clear the heat toxin and the pathogen from a deeper level. And so, that might be an indication where we use this particular herbal combination. So that's a little bit about abscess and what we would call toxic heat accumulations in Chinese medicine. And we'll see you next time.